A little bit about my company. We started it in 2021, and I'm the founder of the company. And the presentation today is going to be what we do in terms of basically building a platform to, in essence, deliver asynchronous care to patients. So the origin story is that basically during COVID, okay, I own and operate outpatient care centers. During COVID, patients disappeared. They didn't want to be seen. Doctors didn't want to go to the office. Staff didn't want to see patients. Everybody wanted to stay in their house. It's kind of hard to pay bills when patients don't want to be seen, okay? So what we said to ourselves was, hey, let's see if we can start doing telemedicine. It was sort of an innocent approach, but telemedicine in and of itself had some problems, okay? Telemedicine required patients and doctors to be at the same place at the same time, and guess what? That's really damn hard to do, okay? So what we did was we started to rethink, in essence, how to provide medicine. And the way that we basically started to envision it was the idea of, in essence, a standing order, right? Which is, if you know enough about a patient, you can actually treat the patient. And in essence, that's what we did. We started to basically do that. Again, running into more problems, which is to say that the software systems were awful. Like, they didn't work. Nothing worked, okay, in terms of doing the type of medicine we wanted to do, which is this idea of asynchronous medicine, right? So what we did was we basically create an async optimized clearing and settlement platform, okay? So we have this lot of software. It does a lot of different things, but fundamentally what it does is it acts as a front desk, triage, and a checkout. In essence, providing, in essence, the patient, in essence, a way of coming into the system, doing so and with self-service, basically creating a chart for a doctor, putting it in the doctor's system, letting the doctor read, and in essence, basically either approve or edit what was created. That takes a lot of technology. It takes a lot of data. It takes information from payer systems. It takes information from AI. It takes information that the patient gives you. It takes clinical protocols that we have, in essence, negotiated with a provider. And what we do is we take all of that information, create a note, the simplest thing, a SOAP note. And what we do is we give it to the doctor. That allows the doctor to, in essence, start to work, okay? And then once that's done, what we then do is we then check the patient out, which is to say we make sure that the patient is getting all of these care instructions, pharmacy, all of the stuff that happens on the end. We do this all on one platform, okay? And we do it without, for the most part, actually physically seeing the patient. So all of the nonsense with patients missing appointments, not showing up, the doctor being late, things getting delayed, that all tends to disappear because you're allowed to work, in essence, off inventory. Patient creates their own inventory to be seen by a doctor, and then the doctor basically processes that inventory. Okay, so we launched our MVP in 2023, started the company in 2021. We're up to about net 5 million net revenue at this moment in time. And I apologize. And we are very early in the cycle in terms of doing asynchronous medicine. I think Andreessen Horowitz sponsored some article from some company that they funded, basically focusing on asynchronous medicine as a path forward for folks to basically, folks in the medical industry to be more profitable and to work better. Okay, we've seen over 80,000 patients so far, most of them asynchronous. Some of them we still have to see on camera because it's necessary. And we've done, I think, pretty well in a short period of time. So what is it that we do, right? Kind of at the basics. So we've seen a lot of patients, but mostly what we're doing is we're treating episodic care and, in essence, gap care, similar to what many people would consider to be kind of urgent care, primary care type stuff. That's, in essence, what we do on the platform. Okay, I need a prescription, I need a refill, I need this, I need that. Now, that may not be very complicated, but guess what? That's a significant part of, in essence, the outpatient experience in this country. So again, going strong, growing. The value proposition. The value proposition is about delivering asynchronous care, very quick care for the patients. We're delivering all that, okay, in terms of the patients we've acquired. The second part, and I think this is extremely important to anybody who manages a P&L like I have, our doctors see a lot of patients really quickly, which allows, even if you're getting paid a Medicaid reimbursement rate versus, something better, allows you to operate a profitable practice, okay? Extremely important in what we do, okay? The other thing that we've been able to do is we're actually focusing on trying to find the highest LTV patients, which are insured patients, okay? So again, we're bringing patients in, we're seeing patients, we're servicing them, we're taking their insurance just like what you would see today. And what we're able to do is, in essence, target and go after those individuals who, for better or for worse, are the more profitable segments of the marketplace. That's what we've done to date, okay? We, a couple years ago, we made the relationship with HITLAB, and in order to kind of validate all this, you might be wondering kind of like, does this thing work? What is it exactly? And basically, we worked with HITLAB. HITLAB basically did 3 different sort of analysis with us. One basically on the patients to see how do they like this asynchronous medicine thing. We got pretty good results. Then we did another short study with the doctors. Like, how do you like this? Because this is different medicine for doctors. They're really uncomfortable with this. But the doctors who were basically part of our network were like, yeah, we tend to like it. It's actually pretty good in terms of what we do, okay? And then lastly, the people who actually provide referrals into our platform, okay, which can be a pharmacy, it could be a work comp carrier, it could be a lot of things, in essence, find different value points to basically work in this way. So for example, with, injured patients, for example, who were injured on the job, using this platform allows them to avoid people losing work time. They get the paperwork done on time. Those types of things are very, very possible with what we do on our platform with asynchronous care. So where are we today? Basically, we acquire patients DTC, which is, I'd say, it's direct to consumer. We use sort of Google and all of those things, as well as we also use sort of private label relationships with different referral parties, people who typically send them to the doctor. Hey, I can't really help you today at the pharmacy. Why don't you go to the doctor and they'll give you a prescription and come on back? Well, we basically do that for them in essence that same day. So we see the patient, QR code at the store, QR code scan, basically see patient, get prescription back, and in probably 60 minutes to an hour, that patient is having their medical needs satisfied. Yes, we're raising money. I really don't want to believe this. But why do I think we've done well? First of all, we're experienced. We know the business from the bottom up. Like, I started my entrepreneurial journey working a front desk. I know what it is to deal with patients, okay? I know what it is to deal with doctors, and I think that everybody on my team is essentially complementing that. It's really, really important to understand how doctors actually work, because if not, what you end up getting is a lot of technology, and I'm a technology buyer, okay, that frankly doesn't actually solve big problems. We're trying to solve big problems with the platform that we're putting together. The platform, again, we go direct to market, we go direct to consumer. We also basically use it to a channel partner, to a referral partner. So from our perspective, we're agnostic in terms of where the patient comes from. We just want to basically see them, process them, and get them the medicine that they need as quickly as possible. So that's it. So that's a little bit about Helix. That's a little bit about HelixVM. And if anybody has any questions, I'd be more than happy to answer. Okay.
I have one.
Oh, wait, go ahead. Please.
So how are you, I think you mentioned Google and other, because you're D2C.
We do D2C.
How are you, are you using mainly those channels to scale?
Well, the 80,000 patients, the vast majority have come in through D2C. Some of them have come in through our private label, through the private label referral channels. And scaling is a challenge with Google, obviously, because of the competitiveness. However, one of the things that we focus on in terms of our solution with Google is, again, how do you market profitable segments? Like, let's be honest. Not every patient who comes in medicine is profitable. One patient is ridiculously profitable. The other one's ridiculously not. Okay. So from our perspective, some of the interesting stuff that we're doing, shall we say, some of the prop stuff that we're doing is actually about identifying and segmenting the marketplace at a retail level and being able to sort of, quote unquote, cherry pick the customers that are most attractive to us, because at the end of the day, we're taking the risk, the financial risk of that transaction settlement.
Wow.
Oh, go ahead.
I'm curious how you're working with the payer, like outside of a Kaiser model. If you're working with the payer, do you also have to be contracted with the
Well, we have a purpose-built provider team, a provider group that basically focuses on asynchronous medicine. And so as a result, in essence, the way the model works is basically they, in essence, bill, okay, the work that they do, right, based on the note that they create. We then, in turn, when the money in essence is received by the physician's practice, they take their piece of the action, and then in essence they second the remaining dollars to us. So we are not actually billing the insurance company. What we are doing is letting them bill the insurance carrier, and then what we're doing is we're picking up the actual processing of the patient portion and then managing that process for the physician. So that way the physician's practice, for the most part, is working off its existing EMR and its existing RCM systems. And then what we're doing is we're actually doing, in essence, the patient management piece of it. So that way they don't have to worry about that part.